In this video we're going to talk about making some birth preferences or birth planning and talk about the role of your birth partner because they've got a really important role to play in birth too. So making birth preferences, on page 29 in your green booklets you've got a section in there that you may like to jot some ideas down about things that you may like as part of your birth experience. Perhaps letting us know who's going to be there to support you, and perhaps to let us know if there's anything we need to know that's specific about you, maybe dietary requirements. Perhaps there's something we need to know about your birth partner. Perhaps your birth partner is diabetic, or something that we would be helpful to know. To jot down in here some ideas, perhaps thinking about the options you may choose to use for coping mechanisms and for comfort relief options. Thinking about who you might like involved in your care. So there's a little bit on the care plan to decide and prompt some discussion about whether you would like a student to be involved in your care. So at Harrogate we have student midwives from both York University and the University at Bradford. We occasionally might have some medical students on the ward as well. To have a student midwife involved in your care can be a real bonus to your experience. All student midwives are fully supervised at all times. So it might be a first year who is just kind of doing lots of observations and sort of learning skills alongside the midwife. Or it might be a very experienced third year midwife who's nearly ready to qualify. But if a student is involved in your care, you'll still be under the care of a registered midwife, even if that student is pretty much taking the lead in your care. Having a student involved just means that you can have a little bit of extra support. If you happen to come into hospital in the early stages of birthing, in the piece of string phase, you may come to maternity assessment, and that is a 5-bedded unit. So because the birth is not in the active established phase, then the care is not necessarily going to be one-to-one. Potentially that midwife is looking after 4 other ladies. So to have a student involved at that point is great because they can be there to kind of reassure you and to talk you through, remind you about the importance of breathing, perhaps to give a little bit of a massage or something that can just help you feel a bit calmer and relaxed. So students are great. Thinking a little bit now about the role of your birth partner. So typically we would allow one birth partner in the pandemic. Again, as things are improving, it might be that we go back to saying that 2 birth partners are welcome to join you for support during birth. So do check with your community midwife about the current advice. The role of a supportive birth partner is really well documented in evidence as being helpful to enhance your experience of childbirth, and can actually even go as far as to reduce the sensation of what you're feeling and to help the process feel much more comfier. So it's really important for birth partners that we support you and give you a little bit of guidance about what your role might entail. To have a chat through about your expectations of each other as well. So just to give you a little bit of guidance, I like to use this little acronym to support your partner during birth. So this is going to come up on a slide at the end for you to be able to see. But I'm going to talk about PER. So P is going to stand for position. So all that we understand about active birth positions, about being upright, forward and open. And if you haven't seen this already, then look at the video on this. We know that these positions are going to make births shorter and comfier. So if your partner is in one position, perhaps laid on her back in the bed, and she's finding the contractions uncomfortable, then generally during a contraction you don't want to have a discussion, but between contractions just gently remind her about how these positions might make her comfier, and then perhaps offer to support her in a position. So perhaps suggest that she pops her hands around your shoulder and neck and sort of leans into you for support, or maybe suggesting that she finds a position where she could get into all fours and you perhaps offer a little bit of massage over her back if she's feeling some pressure there. So position is really important. U is going to stand for urination, so the importance of bladder care. And if the bladder is nice and empty during birth, then it's not taking up space for the baby to move through. So again, not during a contraction, but between contractions, remind your partner if it's been 3 to 4 hours and they haven't been to empty their bladder, so that the bladder is kept nice and empty. So urination or pee monitor is a really, really valuable role that you can play. They're going to be 4 R's now. So the first R is going to be for rest. Again, linking back to a video that we did on this, previously discussing coping mechanisms for birth. So that early stage of contractions, when things are a little bit regular, maybe just starting to feel that contraction every 10-15 minutes, then to listen to your body. That early phase or that piece of string phase, we don't know how long it's going to last for. It might be a matter of hours. It could be much longer than that. So yes, it's important to be active and upright and forward and open. But actually, at that beginning stage, if you're tired, if birth is starting at night, then the rest is more beneficial, and to both of you. Okay. The next R is for refreshments. So making sure that you've got some bits ready to go in your birthing bag, to keep you refreshed and to give you some hydration and some high energy snacks. So not just for mum, but also for the birth partner, because actually your birth partner is going to be less able to support you if they've missed 2 or 3 meals and feel really sort of shaky and that they really need to eat something. So having some bits in the bag to keep them going as well. If you're choosing to birth in hospital, it might be that actually you want your birth partner to stay with you at all times so that they aren't able to go and get something more substantial to eat. So some snacks to keep them going as well is really helpful. Another R is for respirations. So we've talked about the coping mechanisms, about how important long, slow, deep breaths are, that the more you practice, the more autopilot it becomes for birth. And it helps to keep you focused and relaxed. Your calm breath then means your body follows. So spending some time in pregnancy, just 5 minutes, perhaps in an evening when you're both in bed and relaxed, supporting each other and both doing some deep breathing. And it really, really will make the difference when it comes to breathing well for birth. Another R is for responsibility and reassurance. Okay, so a birth partner that has gone through the parent education slides with you, understands about the process, understands how to support you, that they have that confidence inside them as well, as they understand how your body is designed to birth and how your baby is designed to fit. And for birth partners, it can be really hard, particularly if your partner is finding some parts of the birth process a challenge or maybe having some discomfort. Your partner is likely the person that you love the most, and to see them in some discomfort is hard. But about remembering that if you look relaxed and confident and reassuring, then that's going to have a positive effect on your partner as well. So a little bit like the swan on the surface of the water, that you have this confident, relaxed kind of look about you, even if inside your heart's going 10 to the dozen or your legs are flopping, okay? That you reassure your partner that she's doing great and that this is all really normal and that you're so proud of her and she's doing a great job. And just being able to see that look of relaxation and confidence in your face will really help her with the birth process as well. Other little practical tips to consider, perhaps thinking about the use of phones when you're having the baby. So having a discussion antenatally, will you let people know that birth is imminent, friends and family, or will you keep that information to yourself? If you are going to let friends and family know, then it might be worth just nominating 1 or 2 key people that you can provide updates to, and then they can cascade the information to other people. It can be really frustrating for a woman who's birthing if perhaps her partner's phone is on and every 2 minutes it's pinging a message, and then the birth partner is on the phone and sort of trying to update and respond to these messages, when she's actually wanting their support to perhaps pass her something, or to do some massage, or to do something. So it's worth having a chat about your expectations of each other. Another little practical tip is perhaps your partner understanding what everything is in your birthing bag. So some ladies say it's helpful that they put everything out that they want in their birthing bag, and then the partner will pack the bag so they know exactly where everything is, so that if your partner asks you for a sanitary pad during the birth process, that you know what one looks like. Perhaps your partner's never used sanitary pads and only ever used tampons. You know what it looks like and you know where it is, so that you can get that straight away and it's there for her. Rather than perhaps your partner's spent time packing this beautiful bag and then she asks you for something and you're in it like this, kind of pulling everything out, saying, is it this, and being a bit unsure, so that you know you're in a position to get all the things that she needs to keep comfy and to feel relaxed. So I hope I've given you some good advice to support your partner during birth. You make a great team if you work together and support each other. So wishing you all the very best as you prepare for your baby's birth, and enjoy. Okay, thank you.